Morning. So the reason why I want to start this YouTube channel and see where it goes is because I have a lot of experience and feelings and passions left over from time spent working with a holistic dental office and the holistic health practitioners who naturally worked in collaboration with that office. And to the degree that the things that we did were effective, I think I would feel better if I shared them to help out. So I'm going to endeavor to make some videos about some of the activities that I think are beneficial to solve the problem of liability, code of ethics, violations, playing well with peers. Because the main challenge that I see for truly holistic health practitioners is that implicit in their niche offering is an indictment of the more mainstream offerings of the peers in the space. Those peers don't appreciate either tacitly or implicitly being singled out as having a substandard standard of care. And so associations by necessity have to sort of reprimand those who have a more broad definition of what constitutes scope of practice. And I get it. By necessity, from a training and a liability standpoint, people are practitioners. They're DCs, they're naturopaths, massage therapists, nutritionists. There are a lot of things. Doctor of dental surgery, anyways. But from a patient's perspective, increasingly patients who are dealing with messy garbage pail diagnoses that they get their green sleeve and they're sent home to work on their own. There's a point at which those patients look at, statements that haven't been evaluated by the FDA, and that doesn't scare them off. And in fact, when you've got nothing left to lose, that sort of information increases the likelihood that you're getting information that's not compromised via economies of scale driven conflict of interest stuff that comes off the conveyor belt. And so what I'm saying is if you truly are a holistic practitioner, I would argue that there's a lot of stuff that you can't put on your TV that people want to give you for free to put on your TV because it does not match your culture, and your patients will feel it instantly. The instant, you put up fluoride this, and I would even say too much of a bent to cosmetic dentistry at the expense of a foundation of true oral systemic health. Anyways, so I'm going to endeavor to try to download some of that stuff, and I guess the viewers of the market can decide whether there's value or not. Cheers.